So you might be wondering, what is with that thumbnail? Well, let's jump right on into it. We'll be looking at what true psychosis is and distinguishing differences between fake psychosis and real psychosis. Let's jump right on into it. And yes, there will be memes as well. Let's get into it. So we're going to be breaking down in particular psychosis with visual and auditory hallucinations in particular. However, before we go any farther, let's first, when I say fake psychosis, distinguish what I mean by that. Meaning, a more specific term being malingering psychosis, what you saw in the thumbnail. Malingering psychosis, so what is it? It's a falsification of psychiatric symptoms to gain external incentives, meaning things such as financial gains, avoid punishment or crime, like if you're in a jail and you're wanting to get out of that situation, or even try to get medication in even like, for example, the jail setting, or even if you're homeless trying to get for example, into the ER, get a psych bed when you're not actually mentally ill. A lot of times, for example, even in psych hospitals, and I don't have a problem with this, but when there are patients who are truthfully sick and not being on the floor they're needing, or they're not getting accepted into a hospital, when they're sick and you have somebody who, for example, let's just say is homeless, nothing against this, again, that's not a problem, but in particular, somebody who's, for example, homeless and just irritable, mean, grouchy, and they're just taking it out on staff and whatnot, for example, that's the kind of stuff I have problems with. But that would be an example. Or somebody, once again, who is in prison for whatever reason, trying to get medications prescribed to them, saying they're seeing or hearing things when they're really not. Now remember, there can be two things such as drug-induced psychosis and whatnot that could be going on. But this is for people, once again, faking psychosis. Now, real quick as well, what does psychosis mean? It's a group of symptoms that affect the mind, or you lose touch of reality through even things such as delusions as well. You type that in on Google, that's what it will give you. Once again, big part of that, losing touch with reality. Now, another thing, we're going to jump into, when it comes to malingering psychosis, first we'll jump into auditory hallucinations. We'll break down auditory right here, and we'll also break down visual hallucinations into two subcategories. And what we'll also do is break down each category into sub-ones. So when we're talking about auditory hallucinations first, let's first talk about somebody who has genuine auditory hallucinations compared to somebody who has malingering hallucinations. So typically somebody who has genuine hallucinations, they are hearing voices, auditory voices. I put an example here. An example would be somebody who hears voices of an angered neighbor in negative context, meaning that with it, a lot of times with it, it's that paranoia and there's a negativity factor that goes with it where they're not wanting to talk about it. They're not wanting to talk about the auditory hallucinations because they're worried about how it'll be perceived by the person even assessing them. So the big key with auditory is this negative context right here. Now malingering, so this would be somebody faking it. Voices with little negative content. That would be little negative content. They're more open to talking about it as well. They also, when it comes to the auditory hallucinations, if they're faking it, a lot of times they obey commands, and they are extremely, and another thing about it is, they are a lot of times more extremely distressed and overly emotional about it. And you might go, well, wait, wouldn't it, if somebody was having genuine auditory hallucinations, be that way too? They could, there's always exceptions, but a lot of times with genuine auditory hallucinations, yes, they're negative context with it, so they think they can be fearing they're doing something wrong. But another thing is they're not wanting to show emotions with the auditory hallucinations because they're, for example, scared of being judged. And a lot of times with these genuine auditory hallucinations, lots of times if there are legit auditory hallucinations, there are little emotion shown. Once again, because they're not wanting to be perceived this way a lot of times, and it hurts them a lot of times. Somebody who's faking it, again, they'll go into depth on what's going on. They'll try to be persuasive to you. So these are just little things to point out that I've noticed as well, working in the psychiatric setting. Now, let's go to visual hallucinations real quick. So with visual hallucinations, seeing things, auditory once again hearing, but visual hallucinations, with genuine visual hallucinations, fearful, upset. So little different with this. So compared once again to auditory hallucinations, the genuine right here, genuine, once again with it, there is a negative context with genuine, but with genuine visual, in this way, they're fearful, upset. A lot of times it's visuals that they've never seen before. And a lot of times they're a lot more distraught and emotional in this way. With auditory, with malingering auditory, which once again would be they're faking it, they're going to act overly distressed. But when it comes to the visual hallucinations, a lot of times, genuine, they're going to show more distraught emotion. They're going to be reporting things that they've never seen before, because a lot of times they're not repeated things they're seeing. There can be atypical hallucinations and whatnot, but for this, let's just stay focused on this real quick. So they're going to be a lot more fearful about what they're seeing. Now with malingering, or I'm just going to write once again, with malingering, when I keep saying that, fake. That's the key word. With malingering visual hallucinations, these are changes in so examples would be changes in hallucinations when eyes are closed, they're more descriptive and are more open to discuss and not as fearful and scared. Also, a lot of times they're discussing things such as changes, there's more, changes in black and white colors when it comes to these types of hallucinations. They're a lot more visual, they'll be a lot more descriptive. So one thing to key in on a lot of times if you're questioning if somebody, once again, is in psychosis or reporting visual or auditory hallucinations, are they being descriptive? Are they changing the story on what's going on? Are they showing emotion? Because a lot of times if they're discussing things that are just constantly going on and on and on, and it's changing, and you're not staying specific with the questions you're asking and whatnot, they could potentially, it could be malingering, it could be a form of malingering hallucinations in an auditory or visual way. Now, once again, there can be drug-induced hallucinations going on, but if there is no drug use being involved and you're questioning this all of a sudden, this would raise a red flag to go potentially get someone some help for this. But a lot of times today, once again, I'm not saying there's different factors that go into this, but there are people, unfortunately, who do play the system to get into psych hospitals. Now, let's do a little bit more on the malingering psychosis and signs and symptoms. Some other things to look out for, and this is what I've seen: overacting. Once again, overacting of psychosis, calling, and that's big. Overacting to the psychosis going on. They won't be quiet about it. They're giving you more and more insight on what's going on. Something doesn't seem right. And obviously, it's a lot of times it's not right because they're, not seeing anything. But if they're giving more and more descriptions and whatnot, that could be a red flag. And also a lot of times, if it's something that, all of a sudden they're seeing right now and they're giving you all this feedback on it, that could be another sign too. Because once again, a lot of times when it comes to hallucinations, people who are having true visual or auditory hallucinations, they're not necessarily new hallucinations going on. And a lot of times they're not wanting to talk about it because, once again, a lot of times they're not wanting to have to take a new medication if they're taking one. They're not wanting to give insight. A lot of times it can be a lot more quiet about it. Now, another thing, calling more attention to illness. That is big as well. They are calling more attention to it, saying, see, look what's going on, look what's going on. As I said, a lot of times if you're truly having hallucinations, they're not going to be telling you. They'll be a little bit more paranoid about it. Also, a lot more times from what I've seen, they have a higher chance of threatening the healthcare providers. Like if they're not, for example, getting a bed in the hospital, they're going to do this. They'll start acting in kind of a homicidal way in order to get what they're wanting. And a lot more times, and there's a lot more contraindications in regards to their form of psychosis, which is big. And I'll say this again, a lot of times when it comes to psychosis, different forms of it, if somebody's faking it, you sometimes have to look at their full background on what's going on, but also, are they jumping from hallucination to hallucination, being threatening? Do they have a history of this? You have to look at the whole picture in regards to this. And you might be saying, well, why are you talking about this again? I mean, what's the deal? Why? Because today there is a rise in hallucinations and psychosis going on, but unfortunately there are a lot of people who play the system who don't have anything going on. Or I've even seen, and I'm not going to lie to you on this, I've seen some YouTubers out there, I'm not going to name any by name, that talk about having, oh, I'm in psychosis right now, and they're doing a video. No, you're not. A lot of people are in psychosis talking about their symptoms and whatnot. You're not in psychosis. Sorry to burst your bubble on that. I don't care if anyone takes offense to me saying that. It's true. 9 times out of 10, somebody going through psychosis, unless it's atypical psychosis, and this goes sometimes with schizophrenia as well, they're not going to want to be talking about it. And if you're saying you're in psychosis, you're not. You're probably not in psychosis. That is your daily dose of mental health. Please like and subscribe. Delirium tremens video will come out once again the next couple days. I'm almost done with that in regards to alcohol and benzo withdrawal. Have a great weekend. Hope you liked the video. We're going to keep on putting more out, just anything mental health related, drug related, you name it. Leave a comment. Please like and subscribe. I love you all.